making plans to send NHS workers door to door to check our health? 020 7862 2222 is the number. I'd love your thoughts. The Health Secretary Wes Streeting is planning to send health workers out onto the streets with the aim of diagnosing illnesses earlier and helping to care for people in the community. That would see a health worker allocated to a patch of 120 homes. They'd pay monthly visits. They could even help address issues like unemployment, debt and bereavement. Experts behind the scheme say it'll be much like the return of the family doctor, paying house calls. But critics say this is nanny-stateism. Absolutely 100% slam dunk. And there are concerns also about whether the NHS even has the person power, the manpower. What do you think if you got a knock on the door?
I think this is an excellent idea. And I tell you why. Mum and Dad passed away quite young. The problem was always getting a doctor to come or getting them to a doctor or A&E because my mum was in a wheelchair. And they passed away quite young. And I always blame, actually, had they had more home visits, maybe they could have been saved. And it's very hard for elderly or not even elderly, middle-aged people who don't always pick up the phone, don't always get that appointment to the doctor. And we need to get away from this notion of that we must be behind the four walls of the NHS or the hospital or the A&E. And actually, let's get used to a new narrative of bringing the NHS to your door. This criticism of nanny state, that's a very weak argument.
Do you think it's nanny state?
No, I just think it's a really stupid idea. And I think it's just...
Well, you've obviously not... I mean...
Hang on.
I'm also an orphan, so there you go. Let's not do competitive suffering because it's a very bad rabbit hole to go down.
Are you an orphan as in your parents died when you were young?
But I no longer have parents. Yeah. So it's very easy to say, well, you
weren't brought up as a parentless child.
No, I wasn't. But I always say I'm still an orphan.
Okay.
Now, I was responding to that that you don't know. Well, actually, I do know.
Yeah.
Okay. So I think there's going to be a limited diagnostic capability of people that are going from door to door. What about the cost? As you've said, what about the cost of getting there? What about these sort of very rural areas versus, not everybody lives in an urban centre. What about how effective they'll be when they're there? Not everybody wants somebody just showing up. And if you're going once a month, what happens in between? Does that mean that they think, well, I'll wait another 4 weeks till the community health
Well, actually, the pilot scheme showed an 82% increase in cancer screening uptakes. That's amazing.
So
that's a success.
I'm trying to think, let's say they've got a street and they're going down the street, are they knocking on every door? That's my first question, because it seems to me like you don't want people who want this service. The people you've got to get to are the people who don't want the service.
I don't think they're knocking on every door.
Well, I hope so. Well, then why are they missing my door out?
So this is the problem. What Wes Streeting is trying to do is he's trying to graft onto a very kind of fluid and unpredictable demographic, a kind of a case-by-case, door-to-door sort of approach. And that simply doesn't work. What happens if you're just called out?
But the pilot scheme says it does work.
Why don't you just let me...
I think he's taken the pressure off the NHS.
Go on, finish your sentence.
Right. What happened? OK, we've got these stretched resources. So somebody's finally coming to your house on that day and you happen to be not in, something comes up immediately. I think it is better to put the money into finding ways to have more community resources. I accept the point that it's not easy to get to see a GP, maybe more walk-in centres, more community hubs where medical people will be there, so that you have a reactive approach and you can go where there's a place.
I hate to raise this, but my worry as a slightly overly suspicious person is that you will have people pretending to be these operatives. Once you said you're going to be visited by an NHS operative, now there was somebody who went round during COVID. We're going to refer to someone else in a minute. This is not the person, but the person who went round during COVID and gave people injections that were not the vaccine was a very bad man. This guy, have a look at this guy, Dr. Kwan from Sunderland, disguised himself and went round to his mum's house pretending to be a doctor.
His own mum's.
His own mum.
She didn't recognise him,
She didn't recognise him initially, but she said, you look like my son. To inject her boyfriend with poison, pretending it was a vaccine, in order to kill him because he was worried that she would leave him, the new boyfriend, the money. So he's gone to jail for 100 years.
Yeah, but they're rare cases.
But how many
cases not
do
help
you
the
need?
Community.
How many cases do you need? Because
we need to take the pressure off the NHS and the A&E.
OK, I understand that. I've got people in my family working A&E and they say that people go in on a Monday morning because they can't get a doctor's appointment.
Yeah, but they're going in without, it's for an accident or an emergency.
Yeah,
It is
but because
not
they've had
because you've got a blocked up nose.
Exactly.
people
Or they've
are
had
going in for
they've
that.
had
I
a
know.
bad back and it's been going on for ages, and they think, you know what, I'll go to A&E on a Sunday because I've got the time to go. That happens all the
But you
time.
should find
Yeah,
them.
we are very bad at deploying the limited resources of the NHS, yes. But the problem is that when you have a kind of just a general template, it's so open to abuse. And what about, you say, the supervision of the people that are coming round? Not only for the patient, but for the person who's doing that door-to-door work. How are they to be
Well,
safe?
let's see what Susan in Norfolk now. Are you in a remote area, Susan?
Well, I live near Cromer in Norfolk, which is it's a little village just outside Cromer in Norfolk.
I had one of my first holidays there when I was about 4 years old, so I remember
you?
being there.
Oh.
So
Yes.
would a health visitor be able to get round those houses, do you think?
I don't know, Jeremy, but I really don't think it's a good idea. I actually think that you'd probably get a lot more of old people who do need them, but who actually you'd get people trying to sort of get into houses who shouldn't be them and claiming that they're actually from the NHS.
Yeah, they'd need a kind of, not just a normal ID card, they'd need like the sheriffs have in the States with a gold badge on.
Yeah, I don't
something
like the idea at all.
heavy.
I'd be terribly frightened for old people.
Yeah, but then, okay, let's say we can keep the scammers out. Is it not a good idea? So the classic example is, Susan, I once had, I'm going to do a health confession here, an overactive thyroid.
No way.
It's a really weird one. It's 20 years ago. It's only because I was rushing around so much. And in the end, it's not a good thing because you just are like that the whole time. One of the symptoms, which I didn't have, is that your eyes bulge. Now, you will have seen this. Sometimes people have bulging eyes.
Because of the iodine.
And actually, they sometimes don't go back down. Now, I'm now an expert in, obviously, everyone is an expert in their own condition. So I can now see somebody who's got an overactive thyroid. Now, the question is, Susan, whether we need people from the NHS to go around pointing out, you've got an overactive thyroid. Report to your doctor immediately. You look like you might be 20 stone. Get yourself seen. It might be a good public service, Susan.
Yeah. Yes, I agree, Jeremy. It's just that there are people going round that say they are policemen and get into houses, and that's why I'm frightened that people going round will say that they're from the NHS and get into people's houses when they aren't actually from there.
Well, I hope we haven't added to your fear. It's just an idea at the moment, so don't worry. OK, Susan?
What you say, sorry, very quickly, is what will be the range of their diagnostic capability? So it's, if
Not much.
somebody, we've had a whole thing about nurse practitioners, about the fact that they're taking away from doctors, pharmacists. OK, they still have a limited scope. We certainly don't have the resources to send doctors out to do this. So you're automatically going to be limited by the people that will be going out to do this.
Do you think it's okay that, this bulging eye thing? Right? I've seen occasionally, and I thought, you've got an undiagnosed overactive thyroid. Should I say that to a stranger?
Definitely.
Yes.
You think so?
Yeah, I think so too.
Wow.
We've had cases where newsreaders and things, viewers have rung in and said, your lens glints slightly when
they either see a tumour. They see a tumour. Classic is a flash photo of a baby, and you see a tumour in the eye.
Yeah.
Or the newsreader who's got slightly reddened whites of his eyes. Turns out it's more like a yellowy thing, and it's the cholesterol build-up, and it's like,
or it's liver.
They said we've had a call downstairs saying you're about to have a heart attack, and it turned out to be true.
Yes,
So, pointing out other people's health problems. I'm not going to be doing that.
I don't think they're going to be knocking on doors pointing out health problems.
Well, no, but I'm saying maybe we should all start doing it. Tariella in Manchester. Hello, Tariella.
Hi, good morning.
We like your name here.
I love your name.
Yeah.
And your city.
Oh, thank you.
So, Tariella, do you think we should have this door-to-door service?
I don't agree with it. I don't think it will work. It's going to be very, very expensive to start with. One, I used to work in the community, so I know how difficult it is for staff. Even though you're kitted up in your uniform, staff might even know you. Sometimes you get antagonized by the patient family.
Yeah.
And it will be difficult for me to just walk in, like you just said, to say, oh, I can see yellowish in your eye. You might have this, you might have that.
Yeah.
So at what level? Is it at doctor level? Is it at nursing level? Is it at support worker level? Would the NHS staff be attending?
I think it's got to be somebody who's a paramedic, but reads a lot of Google in their spare time.
Right.
So they've got
nursing level. It's nursing level.
It's more. Yeah.
It's
Nursing.
very expensive, cost-wise, right? You use your own vehicle to visit patients, And then again, the travel expenses, you don't get paid enough travel expenses.
True.
One.
Yeah.
And then again, in the community, I experienced it. My car had dings and dents from members of the community. Why? Because I've parked in their space. Just to go see a patient to give administer insulin. 10, 15 minutes, I'm out. But you get that attack from the community.
Oh,
and then
I'm
there
sorry.
are a few trusts in Manchester that are beginning to tax that expenses that you get back. You've been taxed by the taxman. It's your money. You fill up your tank, and then you go out to work. They're now planning to tax that expenses that you get back.
Okay.
So you get taxed double.
All right, Terry.
So I don't think it's going to work.
So yeah,
I don't think
hear
I'm
you.
going to go back.
That is a good point. We've got to assume that the people who do it don't get ripped off by their employers. Thank you, Terry. Alan in Cambridgeshire, what do you think? Door to door.
Yeah, I think it's a good idea.
Right, because I was thinking no one's in favour of it, and I don't see why. If you could pay for it, it's a bonus, isn't it?
Yes, I think it is because give you an example. My dad was going to the doctors.
Yeah.
He never got looked at.
Yeah,
Rushed into hospital, died.
correct.
And then the doctors say this could have been avoided if he got doctor's appointments. Now my mum's grieving every single day.
Oh, Alan.
Within 9 days, my dad was in hospital and died.
And what did he die
And
of?
it could have been avoided. I was on a prostate list. My family's got prostate cancer. 3 years now I've been asking the doctors, and I've still not been referred.
Wow.
And what did your dad die of, may I ask?
They said it was a heart problem, but they said the doctors at the hospital, Papworth, said he could have been on a course of angina tablets.
Now,
3
that's
weeks
exactly
prior-
what happened to my dad, Alan. That's
Really?
exactly
Yeah,
the
3
same.
weeks
He
3
should have been
weeks
on the
prior-
tablets, but he wasn't seen.
Yeah. 3 weeks prior, we'd been to Skegness. My dad had walked down the beach. My dad could do squats.
Yeah.
And my mum grieves every single day.
Oh.
And the problem-
rushed
The
to
heart
Papworth.
disease in the family is an
The
absolute
problem is with this,
awful
Alan, is
thing.
when you've had a shocking bereavement like that and you've not had access to the health service, then respectfully, anything that sounds like it's a better opportunity to get that is absolutely... And I would say, by the way, with your prostate, absolutely demand, if you've not had a PSA test, absolutely demand one and say it will be on your head if this isn't picked up.
Yeah, you must.
I would say, finally, the other problem about this is the numbers game. I'm going to see Jeremy Vine, you're on my list, and then you say, well, actually, while I'm here, my Uncle Billy's visiting and he's got a bit of a bad cough. He's not on your list.
I'll need the whole morning for you guys, because you're going to make me coffee.
Yeah.
You're going to talk about Coronation Street.
Yeah.
I'm going to be good at my job. I'm
How
going to
many
listen to you.
people in the house do you see?
Yeah, and then,
but then
do you know
cause-
what? You hit someone with mental illness.
Yeah.
And then the counselling session is going to happen right there.
Well, you just
And
put
then
a
there's a
timer
risk-
So
on.
I
You
would-
just put a timer on, and
No.
we've got 10 minutes.
If I do this job, I'm doing 2 people a day.
Yeah.
Literally. And then they're going to come back and they're going to sack me. And I'm going to say, the reason I did 2 people a day is because I'm good at my job. And I sat and listened.
No, but when you see the doctor,
Not
they
rushing
give you
in and
10
out.
minutes. Yeah, exactly.
No, I'm not
So-
rushing in and out. I'm sorry. I'm going to do 2
No, because
people
you're
a
in
day.
your own home. In the doctor's surgery, there's a sense of people waiting. You see
Well,
them in the
literally,
waiting
they
room.
say, right, we've-
In your own home,
Yeah.
you feel, OK, you chose to come to
Yeah,
my house.
absolutely.
Uncle Billy's here with a
Cup
bad
of tea.
cough. Come and have a chat with him.
It'd be like that, what is that film, Heretic? You're not getting out of here. You know what I mean? They're not letting the person go.
Imagine if the doctor looked like Hugh Grant.
Later, it's the papers and everything else.